I'm Dr. Vincent Bacote, the director of the Wheaton Center for Applied Christian Ethics, and to my left is Dr. Terri Watson from our psychology department. And so today, Dr. Watson is going to tell us what she's observed as one of our greatest moral challenges of the moment. Dr. Watson, thank you. So what do you see as one of the greatest moral challenges of the moment?
Thank you for that question. First, I would love to locate myself within psychology, since it's a rather huge discipline with lots of sub-disciplines.
Yes.
And so professionally, I identify as a clinical psychologist. So I'm a faculty member here. I do a lot of clinical training for all of our grad programs, our doctoral and our 2 master's programs, and I get to teach undergrads too. So I think for the clinically focused psychologist who is providing services to the public, we have a pretty strict code of ethics that really guides our thinking about what is moral and what is ethical and legal. And that provides some great aspirational principles like beneficence, wanting to benefit society in our work. We want our work to be just and equitable so all have access. We want to treat people with dignity and respect. So we have these principles that we strive for, and then we have the way we live those out in our practice. And so I think, as I thought about your great question, it's hard to narrow it down to one, first of all, but I think the thing that has concerned me most as a practicing psychologist has been, what is our role as licensed professionals when there is a global mental health crisis? Something that you're probably very aware of, but it's especially since COVID, the rates of mental illness worldwide have just been growing exponentially.
Oh, wow.
The UN has declared it a global crisis of mental health. The World Health Organization has declared it a global mental health crisis. So it becomes, I think, in some ways a moral imperative, thinking about how do we best use our resources as people who have the privilege of advanced training and licensure to try to address that.
Yeah. So what is something that people might be surprised to hear about this global mental health crisis? Because people hear about it in the United States,
Yes.
and people hear about how, okay, now there's more of an openness to people talking about mental health, more of an openness for people to consider going to therapy, for example. What are ways that people might be surprised about what this global dimension of it is?
Okay, great question. I think while in the US, usually we have a plethora of mental health providers to choose from, around the world, the rates of licensed professionals to the population are really low. The World Health Organization, the recent stats I saw from 2025 is there's 13 mental health professionals for every 100,000 people worldwide.
Oh my.
And high rates of mental illness, like 1 out of every 7 persons in our world has a mental illness.
Wow.
And high rates of people that don't have access to treatment. I think less than 10% of people with clinical depression are able to receive adequate treatment worldwide. So I do think some of the worldwide statistics are shocking. People that live in the US in more rural areas probably aren't surprised by those statistics either. But despite all of the great programs like our own that are training people and sending people out in the workforce in mental health, there's still a shortage. So in some ways it ends up being kind of a crisis of capacity. I mean, even people here that I refer for mental health care have a hard time finding someone that's taking new clients or that doesn't have a waiting list. So I do think it's a crisis of capacity for providing mental health care for all that need it.
So sometimes people hear mental health as a crisis. You mentioned depression. Aside from depression, what are some of the other examples of how that mental health crisis manifests itself?
One big one is rates of death by suicide, especially for youth. It's one of the highest reasons for youth dying is by suicide worldwide. And often that's linked, of course, to mental health issues. So that would be one area that we don't automatically link to mental health. But even people functioning with relational difficulties, family and marriage, and the toll that takes on societies worldwide. The number of people living with severe mental illness and psychosis is really high.
Oh, wow.
And the burden that places on churches and communities to know how to incorporate people struggling with chronic mental illness into society so that they can be contributing productive members also takes an economic toll.
Wow. So you mentioned churches. How, this is a completely unfair question.
Bring it, that's okay.
What are you seeing about the ways that churches are open to mental health providers, or even thinking about trying to get access or encourage people to pursue training in expertise in mental health? What are you seeing about the relative openness to that, as opposed to thinking, well, we have what you need, or actually we just don't talk about those things?
Yes, it's a great question. I'll answer it and then I'll give you an example. That I think the church, that there is reduced stigma worldwide around mental health services through the church either providing referral or addressing the need, but that stigma is still there. But I think it's getting better. Many pastors feel a significant burden to be not only a spiritual leader, but a counselor and a marital therapist. So I think mental health providers and pastors working together can be a really powerful combination. So I think one way of building capacity for the church in particular to address mental health issues is to have a licensed mental health provider consulting with churches on developing a lay ministry, like a Stephen's ministry, where people in the church that have the gifts of compassion and counseling can get some training, and they can be supervised by a licensed professional and provide support. I mean, they're not going to provide formal mental health treatment, right, without a license, but they can provide support, they can provide care, they can be a bridge to a therapist that someone in the congregation might need. And I think it's a great use of a licensed professional to build the church's capacity by training lay leaders to provide for some of that care.
I see. So what would you say is one of the biggest obstacles to, I guess, facilitating the training of people for addressing this worldwide crisis?
You know, I think as licensed professionals, it's tempting for people to focus on their own practice, you know, and kind of seeing one client at a time. And when we do that, that's a wonderful way to contribute to meeting this need, but we're meeting with maybe 50 to 100 people a year. And so for licensed providers, I think to see the moral imperative of expanding their reach by doing more group services, for example, where you can reach maybe twice that many people a year, or being involved in providing prevention and education through the church, where you provide relationship education, premarital counseling, and workshops, can also expand our capacity. And then doing consulting with pastors and physicians and other people in the medical field that are already serving the public to provide some of those resources, I think is a really great use of a mental health license to expand the capacity.
I see. Wow. Very fascinating. So I guess my last question is this: if there's one thing you could say to people watching this about maybe something that they could do, what would you want people to do? I know it's asking one thing is, again, completely unfair, but if there's one thing that
you know, part of the reason I came to teach at Wheaton is because long ago, Dr. Fran White, who started all the grad programs at Wheaton College, had a vision for the church as a healthy, safe place for people, and a place where people struggling with mental health issues could come and find community and find opportunities for spiritual growth. And so I think whatever we can do to contribute to building a healthy, whole church, spiritually, psychologically, emotionally, relationally, we can all be a part of that in terms of advocating for more services to address the needs around us, so that church is a resource for communities.
All right, great.
That would be my hope.
Thank you. Very well. Thank you so much. This is very, very helpful. Appreciate
Thank
it.
you.
Thanks.
Thanks for the opportunity.
You're welcome.